No more rabies. Rabies is a vaccine-preventable viral disease. Humans can also be infected through bites from rabies, and other warm-blooded animals infected with the disease, such as cats, wolves, and foxes, can also spread the disease. The disease exists in more than 150 countries and territories around the world. Every year, more than 29 million people around the world receive rabies vaccination after being bitten, and this practice is estimated to save many lives every year. Mainly in Asia and Africa, 40% of them are children under 15 years old. Dogs are the leading cause of human rabies deaths, responsible for up to 99% of human rabies transmissions. Transmission can be interrupted by vaccinating dogs and preventing dog bites. After people may come into contact with a rabid animal, they can take post-exposure prophylaxis, which includes immediate and thorough cleaning of the wound with soap and water for 15 minutes, a series of rabies vaccinations, and, if necessary, rabies immune globulin or monoclonal injections antibodies. This can save lives. Most cases of human rabies are caused by bites, scratches, of animals carrying rabies virus. The incubation period can be as short as 10 days and as long as 2 years or more, generally 31 days to 60 days, and 15% occurs after 3 months, depending on the distance of the bite site from the central nervous system, the degree of the bite, or the degree of virus infection. Dosage varies. The case fatality rate of rabies is extremely high, and almost all people die once they develop the disease. However, after being bitten by a rabid dog, if vaccination can be carried out in time, the disease can almost be avoided. Therefore, it is very important to vigorously popularize rabies knowledge so that those bitten can receive early vaccination. Human rabies is most commonly caused by bites, scratches, of animals carrying rabies virus. The incubation period can be as short as 10 days, and can be as long as 2 years or more, usually 31 to 60 days, 15% of which occur after 3 months, depending on the distance between the bite site and the central nervous system and the degree of the bite. Dose of infected virus vary. Rabies is an infectious disease that affects the central nervous system. It often has a short prodromal period, about 1 to 4 days, characterized by moderate fever, malaise, loss of appetite, headache, nausea, etc. Then it enters the nervous system symptom stage, which lasts about 2 days. -20 days, increased stress, chest pressure, chest pain, and airflow phobia. Wind blowing on the face can cause throat muscle spasm, which is a typical symptom and is helpful for diagnosis. There is pain or various strange sensations at the wound site. Some patients are accompanied by increased stress to light, noise and sensory stimulation. They usually show increased muscle tone and facial muscle spasm. After damage to the sympathetic nervous system, excessive sweating, salivation, manic behavior, anxiety, and spasmodic painful muscle contractions occur. Muscle spasms in the throat and other parts of the body during swallowing cause fear of drinking water, so it is also called hydrophobia. Paralytic symptoms may appear at different stages of the disease. Within 0 to 14 days after the onset of symptoms, patients often develop secondary respiratory and heart failure after spasm, coma and death. Manic type is the most common type in our country. The main manifestations include abnormal sensations such as itching, pain, numbness, and walking in the healed wound and the innervated area. Later, there will be high excitement, fear of water, fear of wind, paroxysmal pharyngeal muscle spasm, and sympathetic nerve excitement symptoms such as salivation and spitting, excessive sweating, increased heart rate, increased blood pressure, etc. Flaccid paralysis of the whole body gradually occurs, and eventually death due to respiratory and circulatory failure. The paralytic type is relatively rare in my country. The clinical manifestations are mostly high fever, headache, vomiting, and pain at the bite site in the prodromal stage. There is no excitement period, hydrophobia, laryngospasm, or dysphagia. Symptoms of limb weakness and paralysis appear after the prodromal stage. The paralysis usually starts at the bitten part of the limb and then spreads radially to the surrounding areas. Part or all of the muscles are paralyzed, the throat muscles and vocal cords are paralyzed, and the voice is lost, so it is called subrabies. Treatment of biting animals. 1. If a suspected rabid dog is suspected, it should be captured and killed immediately. Brain tissue examination should be carried out as soon as possible to check for endometriosis or immunofluorescence to determine whether it is a rabid dog. Since the virus in the brain tissue of rabies can infect people through wounds in the skin and mucous membranes and even through the air, the operation must be carried out in conditional biological safety cabinet. 2. If it is a healthy animal, it should be kept in isolation for 10 days for inspection. If anything suspicious is found during the inspection period, it should be killed and burned immediately.